হ্যালো এভরিওয়ান, গুড মর্নিং, ওয়েলকাম টু মাই ইউটিউব চ্যানেল প্রজ্জ্বল সেলস ক্লাব। আজকে একটা ইম্পর্টেন্ট টপিক নিয়ে ডিসকাস করার ইচ্ছা আছে, সেটা হলো আলসার। কাজের ক্ষেত্রে দেখেছি মোস্ট অফ দ্য পেশেন্ট দ্যাট কামস টু হসপিটাল অর টু ভিজিট এ ডক্টর, they are suffering from ulcer. It may be acute or chronic, sometimes it is long standing and very difficult to manage. তো আজকে আলসার নিয়ে একটু আইডিয়া হোয়াট ইজ আলসার সেটা নিয়ে একটু ডিসকাস করব। সো লেটস বিগিন। ওয়েলকাম টু ইউটিউব চ্যানেল প্রজ্জ্বল সেলস ক্লাব। Okay, let's start. What is ulcer? Ulcer is it is a break in continuity of an epithelial surface, either skin or mucous membrane, due to molecular death. In normal tissue, the epithelial surface is continuous, but when there is a because of different causes, the molecular death or cell death, tissue destruction occur. There is a break in continuity of epithelial surface. So that's the basic idea of ulcer. The epithelial surface, either on skin or mucous membrane. Mucous membrane lining seen in mouth or stomach, different inside our body, different parts. So basic concept of ulcer is that there is a break or breach in continuity of an epithelial surface because of molecular or cellular death. Now it's very important to understand the parts of ulcer. Ulcer have margin, regular or irregular, rounded or oval. Edge, different kind of edge is of ulcer, like sloping edge is sloping to downward inside, seen in healing ulcer. The undermined edge, that is tubercular ulcer, seen in tubercular ulcer. Punched out edge, seen in trophic ulcer or syphilitic ulcer. Raised and beaded edge, seen rodent ulcer, basal cell carcinoma. Everted edge, that is everted to outside, or rolled out edge, seen in carcinoma. The floor of ulcer is that which seen, the part of ulcer which is seen, that is called floor, and the base is on which ulcer rests, either may be a soft tissue or bone on which the ulcer rests is called base. Is a picture showing different parts of ulcer. The margin is a line that demarcates the normal tissue and the ulcer tissue. The floor, part of ulcer, floor is that part of ulcer that is seen, যেটা দেখা যায় চোখে, সেটাকে বলে আলসারের ফ্লোর। বেস অন হুইচ দ্য আলসার রেস্ট, যার উপরে আলসারটা থাকে, দ্য আন্ডারলাইং টিস্যু, either it may be a bone, soft or muscle tissue. The edge that connects the floor and the margin, this called the edge of a ulcer. This is the basic concept of basic idea of parts of ulcer. Now different kind of ulcer edge, sloping edge, that is going downward inside. The mouth is open, wider than the base, wider than the floor. Mouth seen in venous ulcer or in healing ulcer. Punched out ulcer seen in syphilitic or trophic ulcer. Here the edge is vertical, more or less vertical. And undermined edge ulcer seen in tuberculosis. The tissue destruction and deeper plane is more, and the surface epithelium growing inside. So the opening mouth is small, but the tissue destruction deeper tissue is more. No one can't estimate the tissue destruction just seeing the opening of the mouth of an ulcer. Okay. Seen in tuberculosis. And rolled out edge seen in basal cell carcinoma. Everted edge, the edge is everted outside to the normal tissue, seen in squamous cell carcinoma. Pictures showing the aphthous ulcer on mucous membrane inside inside the mouth. A picture showing ulcer on a skin. There is a tissue destruction and discontinuation or break or breach of surface epithelial. Is a picture of venous ulcer seen in varicose vein. There is a eczematous changes and leg ulcer. Typical ulcer is venous ulcer typically seen on medial aspect of the leg, just above the medial malleolus. Now, what is classification of different ulcer? Clinically, ulcer may be spreading ulcer, that is growing ulcer. That ulcer that's growing, it's not healing, it's growing. There is a no granulation tissue. The ulcer is very inflamed, painful, and maybe abscess formation there. And there is a bad smelling slough or and the very painful ulcer. That is spreading ulcer. That is that ulcer that is growing. যে আলসারটা বাড়ছে. And second is healing ulcer. Healing ulcer means ulcer is going towards the heel. যে আলসারটা আস্তে আস্তে শুকিয়ে আসছে বা মানে ঠিক হয়ে আসছে. That's called healing ulcer. Typical features of healing ulcer: healthy pinkish red granulation tissue is there in innermost zone. Healing ulcer have three zone. That innermost zone that contain healthy pinkish red granulation tissue, middle bluish zone with growing epithelium, and outer whitish zone of fibrosis and scar. That's the features of healing ulcer. And there is a non-healing ulcer. The ulcer is not healing. Callus or chronic stationary ulcer, no tendency towards healing. It contain pale granulation tissue. Now, healing ulcer contain pinkish red healthy granulation tissue, but callus or chronic ulcer contain pale granulation tissue, and there is no tendency towards the healing. Depend on duration, the ulcer may be acute, less than 2 weeks, and chronic ulcer that's last more than 2 weeks. Pathological classification of ulcer, specific ulcer seen in some specific diseases like tubercular ulcer, syphilitic ulcer, actinomycosis, Melinis ulcer, malignant ulcer in carcinomatous, rodent or melanotic. Non-specific ulcer seen in traumatic ulcer, arterial or venous cause. Arterial cause may be because of atherosclerosis, Barger diseases. Okay, venous ulcer, trophic or pressure ulcer, because of loss of sensation, this ulcer occur. That's called trophic or pressure ulcer. Infective tropical ulcer seen in hot, humid, hot temperature area. Chilblains or frostbite because of cold, extreme cold exposure. Martoril's ulcer or hypertensive ulcer, Beijing's diabetes, cortisol ulcer, and the ulcer due to lymphedema, jaundice, polycythemia, leukemia. These are the example of non-specific ulcer. Now, 3T ulcer, that is traumatic ulcer, trophic ulcer, and tropical ulcer. What is the 3T ulcer? Traumatic ulcer, that because of trauma or repeated friction that occur. In dental ulcer, because of malaligned or broken teeth, there is a chronic irritation or injury to the mucous membrane of inner side of mouth. Electrical or X-ray burn, chemical injury, that are the example of traumatic ulcer. The trophic ulcer, that is called neurogenic ulcer, occur at insensitive part of body. different causes. There is a neurogenic destruction, or there is a loss or decreased sensation some part of body, and patient is unaware of injury or trauma, and because of pressure, chronic pressure, this trophic ulcer occur in a insensitive part of body. Now, what is tropical ulcer? Common in tropical climate, hot temperature, where average temperature is more or less 18 degrees Celsius. These typical ulcer are most very difficult to manage. Maybe a non-callous or non-healing type of ulcer. So 3T ulcer: traumatic, trophic, and tropical ulcer. Now, what is the grading of ulcer? When you see a patient on ulcer, it's very important to grade the ulcer to understand the difficultiness of management of ulcer. So, what are the grades of ulcer? Grade 0, no ulcer but high risk food. Grade 1, superficial ulcer. Grade 2, deep ulcer, no bony involvement or abscess. Grade 3, abscess with bony involvement in case of like osteomyelitis. Grade 4, localized gangrene seen in toe or heel, that is localized gangrene. Grade 5, extensive gangrene involving the whole foot. So these are the grade of an ulcer. Now, what are the factors that affecting the wound healing? The ulcer is nothing occur when there is a factors that hamper the wound healing. In our body, normally tissue destruction occur normally, and tissue repair occurs simultaneously. But when there is some factor that affecting the wound healing, the tissue destruction is more than the wound healing. So the ulcer formation occur. Now, these factors are in systemic, like age of the patient, nutrition, trauma, metabolic diseases, immunosuppression, connective tissue disorders, smoking. These are the factors that is systemic factor that hamper the wound healing. Local factor like mechanical injury, infection, edema, ischemia, ionizing radiation, low oxygen tension, and foreign bodies. These are the factors that should be modified. Some are modifiable, some are unmodifiable. Like age is unmodifiable. আপনি কারোর পেশেন্টের তো এজ চেঞ্জ করা যাবে না. So in the factor that affecting the wound healing, some factors are modifiable, some are unmodifiable. You can improve the nutrition of the patient. Okay, if there is a local mechanical injury, you can give a protection. If there is a foreign body, you can remove it. So there is some modifiable factors, some are unmodifiable factors. So these are the factors that affecting the wound healing, and ulcer formation. Now, it's very important to assessment of an ulcer. It's very crucial to management of an ulcer because sometimes ulcer may heal easily, but sometimes the ulcer is very difficult to manage. In case of non-healing or chronic ulcer, it's very difficult to manage. Now, you should assess the patient, either diabetic, vascular, infective cause, type assessment, what type of ulcer it is, healing ulcer like healing ulcer or non-healing, or what the pathology behind the ulcer. You should assess. It's very important to assess the type of an ulcer and grade of an ulcer. The assessment of wound also is very important. Assessment of regional lymph node is also very important to differentiate either infective or malignant. The lymph node biopsy sometimes needed to differentiate. It is different to identify the cause of the ulcer. And also assessment of the adequate blood supply towards the ulcer is important because Blood supply is very important. Adequate blood supply is very important for healing of an ulcer. Sensation of an ulcer is also assessment of the sensation of an ulcer is also important. Assessment of wound discharge, the type of discharge, it's cellular or routine examination, microscopical examination, what type of discharge it is very important. The assessment of wound discharge. Now and different investigations for assessment of the ulcer, and also the make a protocol or guidelines to manage a ulcer. Different investigation that's may needed to assess the ulcer is routine blood examination, urine examination, examination of wound discharge, skin test, chest X-ray, biopsy of that ulcer, X-ray of affected part, contrast radiography, ultrasonography color Doppler to assess the vascularity or adequate blood supply is present or absent to the ulcer. So these are the some basic important investigation that needed to assess the ulcer, and also the plan of management for better outcome. It really needed to help to manage the ulcer. Thank you. So that's it. I hope the discussion of ulcer is may help you. I wish you good health to everyone.